Hello everyone. In previous classes, we have discussed about the principles of strengthening exercises, which were overload principle, SAID principle, and reversibility principle. We also have discussed about the factors that influence the outcome of the resistance training. Additional to that, we have discussed the type of resistance that can be used while strengthening. Today we'll be discussing about the types of resistance exercise. So we'll be discussing the first type of resistance exercise, that is dynamic exercises or concentric and eccentric exercise. So in dynamic movement you have concentric as well as eccentric contraction of the muscle. Concentric contraction of the muscle occurs when you lift the weight or when you contract the muscle to lift the weight, and the eccentric contraction occurs when you are lowering the weight while the muscle is in contraction. Combination of concentric and eccentric muscle action is used in our daily activities, for example like walking uphill or downhill, or walking in the inclines, ascending and descending the stairs, rising from the chair and sitting back. So therefore strengthening of the muscles for dynamic contraction is important for fulfilling our functions. So how can we strengthen our muscle from grade 2 strength to grade 3 strength? So we should have the knowledge of MMT examination before we prescribe the exercises to our patient. So grade 2 muscle strength means the muscle is able to contract and take the range of motion to full range of motion when the gravity is eliminated. Whereas grade 3 means muscle is able to take the joint to full range of motion against gravity but not against any additional weight. So how can we improve the strength of muscle from grade 2 to grade 3? We can improve by using suspension and active range of motion exercises. Now how can we take the muscle strength from grade 3 to grade 4 or grade 5? We can take the muscle from grade 3 to grade 4 or grade 5 by using active range of motion exercises, and after active range of motion exercises we'll be using resistance to take the muscle strength from grade 3 to grade 4 or grade 5. So we can use resistance only if the muscle attains 3 plus, that is more than grade 3 but lesser than grade 4. So let's move on to next slide where we can view how to strengthen the muscle of shoulder flexors from grade 2. Strengthening shoulder flexors. How can we strengthen grade 2 muscle to grade 3? First we'll start with suspension. So we'll suspend the arm with the sling so that the gravity will be eliminated. And then we'll ask the patient to perform flexion of the shoulder, and we'll ask the patient to repeat it 10 times for 3 sets. And between every sets we will be giving the rest interval. Position of the patient, as you can see, will be in side lying position so that the arm will be suspended on the sling so that patient can perform flexion in gravity eliminate position. As the arm is being supported on the sling, the patient is performing flexion of the shoulder joint when the gravity is eliminated. The suspension technique will be used only if the muscle is grade 2, that is muscle cannot function against gravity, so therefore we have to eliminate the gravity. Once the muscle gains some amount of strength, we have to take regular feedback from the patient. Do you feel more comfortable to perform these exercises? If patient says yes, then we will be moving to next technique, that is active assisted exercises, where we'll take the arm to anti-gravity position, and then we'll ask the patient to perform flexion of the shoulder, that is in sitting or standing position. But we have to, as a therapist, we have to assist the movement because it is not purely grade 3, it is just gaining the strength from grade 2 to grade 2 plus. So therefore we have to assist the movement. Next, once we attain the grade 3 strength of the muscle, we'll ask the patient to perform active range of motion exercises. That means patient will be performing herself or himself the movement without any assistance and without any resistance, because grade 3 cannot take any resistance. So let's view how patient can perform active range of motion exercises for improving grade 3 to grade 4 or grade 3 to grade 3 plus. So patient performs flexion of the shoulder. The position of the patient can be sitting position or standing position. So patient can repeat the flexion of the shoulder for 10 repetitions into 3 sets. We can use the regime which we have already discussed in previous classes, which were Delorme regime, Oxford regime or McQueen regime. But we'll be using only sets and repetitions component of this regime for grade 3 because patient cannot take any weight for grade 3. So once patient improves from grade 3 to grade 3 plus, that means patient is able to take some amount of resistance, then we can start applying resistance against the movement. For grade 3 plus, let's view the other slide. Once we find that the muscle grade is grade 3 plus, then we can apply resistance. We can apply resistance such as TheraBand, dumbbells, free weights or weight cuffs. We apply weight cuffs when patient is not able to hold or grip the weights. Patient doesn't have sufficient strength, that is grip strength, to hold the weights. During that condition we will be applying weight cuffs. The two end of the TheraBand has to be fixed so that patient gets some resistance from the TheraBand. The TheraBand has to be aligned properly so that resistance is against the movement of the flexors of the shoulders. So what are the flexors of the shoulders? It is anterior deltoid mainly and coracobrachialis. Next technique we can see here by using dumbbells. We can strengthen the grade 3 plus muscle to grade 4 by using dumbbells. This is the procedure how dumbbells can be used. The patient should be stabilized properly. There should not be any trick movements, for example swaying of the body forward and backward. There should not be any inertia created by the movement of the body. The only arm should be moving towards flexion, and the position of the patient is standing. So patient performs 10 repetitions of flexion, 3 sets. And again I repeat, there should be a rest interval between every sets as described by Delorme regime, Oxford regime and McQueen regime. Again, one more important point here, we have to first identify the 10 repetition maximum weight for the patient. So in this video demonstration, patient is using 1 kg weight and performing flexion of the shoulder for 10 times, that is 10 repetitions. Next is again for grade 3 plus muscle, how can we use weight cuff for strengthening the muscle? We can strap the weight around the distal part of the upper limb. This weight is used only when patient is not able to grip the weights because of the weakness of the intrinsic muscles of the hand or the grip strength of the hand. And then we can ask the patient to perform flexion of the shoulder 10 times against this resistance. This weight is 1.5 kg, which is 10 repetition maximum for this particular patient. So 10 repetition maximum varies for every patient. The patient can be in sitting or standing position. Next, how to strengthen the shoulder extensors. So you can see this picture. If the muscle power is more than 3 plus and above, then we can use this technique where the patient will extend the shoulder holding the weights, which would be 10 repetition maximum. So patient will be performing 10 repetitions of extension against the resistance, which is the 1 kg dumbbells. Position of the patient is standing with wide base of support and leaning forward, supporting on the couch by the other arm, and then performing the exercise, that is extension of the shoulder against resistance. So for grade 2, the position of the patient would be same as for shoulder flexors, using the sling to support the upper limb, which is suspension therapy, and the patient will be in side lying position. Next, for grade 2, strength of the shoulder abductors. So what are the shoulder abductors? Shoulder abductors are mainly deltoid and supraspinatus. So if these muscles are weak, that is grade 2, which may be because of the nerve injury, then we will position the patient in supine lying so that the arm can be supported on the sling. And then we'll ask the patient to perform 10 repetitions of abduction for 3 sets. So here is how patient will perform abduction while it is being supported on the sling. So patient can comfortably perform abduction if it is grade 2 while it is suspended on the sling. So patient will be performing for 10 repetitions, and after 10 repetitions of abduction we will give a rest interval. So once the patient gains strength, that is if patient finds very comfortable to perform a abduction while the arm is being supported on the sling, then we'll progress to active assisted exercises. That is, we'll ask the patient to perform abduction against the gravity, but it will be assisted by the therapist. And after that, again, if patient finds comfortable to perform abduction with assistance of the therapist, then we will ask the patient to perform free active exercises. That is without any assistance and without any resistance for 10 repetition and 3 sets. After that, the patient will gain some strength where we can apply some resistance for the patient to perform exercises. So this is the fourth step after patient has gained a lot of strength. In fourth step, if the grade of muscle is more than 3 plus, then we will be using TheraBand, where patient will be performing abduction against the resistance of the TheraBand. Again, the alignment of the TheraBand should be proper, and the position of the patient also should be stable and aligned. Next type of weight that can be used for abductors is dumbbells. Here you can see the patient is using dumbbells against the abduction, where patient performs 10 repetitions of abduction for 3 sets, and in between every sets, again I repeat, there should be a rest interval. Third type of weights that can be used if patient is not able to grip or hold the weights, we can use weight cuffs. So after the weight cuffs is wrapped around the distal part of the upper limb, we'll ask the patient to perform abduction for 10 repetitions and 3 sets. So before applying the resistance, again I would like to remind you all that we have to quantify the 10 repetition maximum weight for every patient. So these were some of the strengthening techniques that we can use to strengthen shoulder flexors and shoulder abductors. The knowledge of MMT plays a vital role before we plan for strengthening of the muscles. We have to know the strength of the muscles, then only we can decide on applying resistance or to apply the suspension therapy for strengthening the muscles. So there are basically 4 steps. First, for grade 2, we'll start with suspension. Then in second step, we will apply active assisted range of motion exercises. In third step, we will move to active range of motion exercises. And in fourth step, we will move to resistance exercises. So these are the 4 basic strengthening steps for muscle strength to be improved from grade 2 to grade 4.